Hi, this is Dr. Jennifer Daniels, and this is part 2 of Murder by Medicine is No Accident. To recap part 1, we reviewed the literature that's mailed to doctors often to alert them when drugs have the side effect of death. And we also reviewed how this literature often instructs doctors not to inform patients of the particular hazard, death. I would just like to explore that a little bit further to say that in the package insert, as extensive as it was, the doctor's only told in one place to discontinue the medication. And he's told to discontinue the medication when the patient is urinating black and defecating gray. This is a symptom of terminal, that means near death, liver failure. And at this point, often death is imminent and even unavoidable. So, with an instruction like this, if the doctor follows it to the letter and does exactly as he is told, the deaths from the medication could be expected to be maximal. And this is how we get 107,000 people every year dying from properly prescribed medicine, prescribed by highly trained physicians in what is considered to be the standard of care in an appropriate setting, and the patient takes the medicine appropriately. Now, I'd also like to give you more of a understanding of the dilemma the doctor faces. And I'll just tell you my personal situation. When I went into medicine, I went into medicine with the expectation that I would help people get better. I had no intention, no plan, and did not sign up to be an accomplice to murder. But this is the position that doctors are placed in, basically being an accomplice to homicide or murder. Now, what I developed when I was in practice was a strategy. I noticed my patients were dying, and at one point it just hit me like a ton of bricks. Could it be that what I was taught to do in medical school is causing these deaths? So I noticed a pattern. The patients who died were always fully medicated. They were taking medicines for their hypertension, for their arthritis, for their diabetes, for their asthma, you name it. They were fully medicated, fully diagnosed, and being treated properly according to dosage and administration as was instructed by the PDR, or physician's desk reference. So what I calculated was that in the course of a year, I saw 10,000 individuals. And so I made up my mind that I would not prescribe any drug that had a death rate greater than 1 in 10,000. So the way the math goes, if I see 10,000 individuals, but I never prescribe a drug whose death rate is higher than 1 in 10,000, then statistically my chances of killing someone are greatly reduced. So that was one rule I had. The next rule I had was I would always check to see if there was a death from a particular drug, what was the dose at which death occurred. Generally, the dose at which death occurs is a therapeutic dose, just by the way. So what I would do is never give more than half of that therapeutic dose. Next, I would determine the duration. How long had a patient been taking a drug according to available information for a particular drug before that patient died? And I would never continue the drug for more than half of that duration. Then I would check to see what was the frequency. Was the patient taking the drug once a day, 2 times a day, 3 times a day? And again, I would never prescribe the drug for more than half of that frequency. So if you do the math, you multiply 1/2 times 1/2 times 1/2, that's 1/8. So my prescribing practices for drugs that were hazardous was generally in the area of 1/8 the recommended amount. Even often it was less than that. One of my favorite drugs was Propulsid. It's off the market now, killed too many people. Now, Propulsid was recommended to be given 2 pills 4 times a day continuously for, of all things, indigestion. But at any rate, it killed a lot of people. I determined that the therapeutic dose for my patients for Propulsid was actually 2 pills twice a month. How about that? For 2 pills twice a month, I was controlling the symptoms instead of using two pills 4 times a day. So this meant that I was using 4 pills a month instead of 240 pills a month. So you can imagine the impact on drug company profits if doctors took it upon themselves to determine the lowest effective dose for each medication they use and never use more than that. Even if we concede that drug companies have very, very high profits, if doctors collectively started prescribing literally 1% of their present volume of medications, that would have a negative economic impact. And so rather than experience this plunge in sales and corresponding plunge in profits, doctors are given information that encourages them, in fact, directs them to prescribe literally a lethal dose in all cases, and to only stop the drug when signs of death are imminent. In other words, stop the drug so the undertaker can measure the body. And this is pretty drastic. Now, the other thing that I did was I would give people a natural remedy for each affliction. And I would say to them, look, this is a natural remedy. If it doesn't work, here's a prescription. Get the prescription filled. Now, I found out over the years that what actually was happening is people really were trying the natural remedy first. And they're getting such great results that they were literally filling fewer than 10% of the prescriptions that I wrote. I found out about this when I received irate visits from the drug reps. That's another story. So, what happened in my medical practice then was my death rate actually went to 0. The deaths of people under 60 just didn't happen. And even people who were over 60, so all ages, people simply were not dying unless people would often come to my practice and say, look, I have this very bad case of cancer. I don't want anything at all done. I just want to die, and can I count on you to let me die and to sign my death certificate at the right time? I said, okay, sure, I can do that. So those were the deaths that were in my practice. I did not have any of these unexpected, mysterious deaths of fully medicated individuals. So one way, so that's how I as a doctor prevented being an accessory to murder, or extricated myself from the position of being my patient's executioner. Now, you're probably watching this and thinking of it from the perspective of a patient. What can you as a patient do to minimize your chances of becoming a victim of murder by medicine as it is now administered? Well, first thing, obviously, is you could just not take any medications. I personally think that's a great solution. I've personally used that solution for over 15 years now. But maybe that's not reasonable for you. Maybe you don't really find that acceptable. The next thing to do is, if a doctor prescribes a medication for you, you can politely accept the prescription and ask the doctor for a copy of the package insert. And the part of the package insert that you want to read is adverse reactions. You can tuck the package insert in your pocket and read it when you get home. So you want to ask for a package insert, and you want to read the package insert, especially adverse reactions. Get out your magnifying glass. You'll definitely need it. That's what you want. If the doctor can't give you the package insert, ask the pharmacist. Do not accept the patient information leaflet, because the patient information leaflet has been fully inspected by the Public Relations Department, and any reference to death has often been removed. So the patient information leaflet does not give you a full accounting of all the effects of the medication you're considering. So the first thing to do is to get a package insert with your prescription. That's number one. Next thing to do is ask the doctor if, to his knowledge, there have been any deaths from this drug. So he's going to give you a couple answers. He's going to say yes, he's going to say no, or he's going to say I don't know. If he says he doesn't know, then that's like a really bad sign. that means he probably hasn't read the package insert. However, if he says, yes, there have been deaths due to this drug, then you can ask him, at what dose did these deaths occur? And you can ask him how frequently death occurs. And he can give you some kind of idea. So if death occurs at the same dose that he wrote the prescription for, then you may want to talk with him about a lower dose, a lower frequency, and if he feels you might benefit if you started at a very low amount. The other thing is the duration. You want to ask him, when do these deaths occur? Do the deaths occur after 1 day of taking the drug, or after several weeks, months, or even years of therapy? This is important because now there are many drugs in the market where death occurs within the first week of taking a drug. And so you really want to kind of nail that down if you can. The next thing that you want to do is you want to ask your doctor, is there anything else you could take? Is there anything else you could do besides a drug or non-drug therapy? And maybe he'll be able to tell you something, in which case try that first. And if it doesn't work, then get the prescription filled and try the prescription. So those are the big ways of protecting yourself from becoming a victim of murder by medicine. Now, I want to say this is a serious problem because citizens, patients, as well as doctors are led to believe that these drugs are fully researched and so their safety is determined. However, in many research studies, it is a common practice to remove anyone who dies, to remove them from the study and not count them. When I was in medical school, it was explained to me that if a patient dies during a drug study, of course you can't count them because if it's a blood pressure medicine, you can't take a blood pressure of someone who's dead. So of course, if somebody dies during a study, you have to remove them from the study and then you continue forward with the study. What does this mean? This means that whether or not a drug causes death can only be determined after the drug has been released to the public. So you also want to ask your doctor, how long has this drug been on the market? If he tells you it's been on the market anything less than a year, I definitely would ask him to please prescribe a drug that's been on the market for at least 3 years. And 3 years is enough time, if a drug is deadly, that it'll have a death record and your doctor will be aware of that. And of course, you can always ask Dr. Google. Google your medication before you take it and put the word death from and fill in with your medication. And that should be a pretty thorough investigation on your part and enough information for you to decide if the risk associated with the drug you're contemplating is a risk that you want to accept. Well, thank you very much. This is Dr. Jennifer Daniels with Murder by Medicine, Part 2. Thank you so much for watching, and please visit me at vitalitycapsules.com.